Cathy is a psychologist and an expressive art therapist specialized in trauma treatment. For more than 3 decades, she has worked with traumatized children, adults, adolescents, and families. She's expanding the range of understanding of nonverbal and sensory-based concepts and methods. She is the executive director of the Trauma-Informed Practices and Expressive Art Institute, and she's provided live online training in person and both online in expressive and somatosensory approaches to more than 25,000 professionals like you around the world, just like you. So, Cathy, in the 2022, you were recipient of a grant from Cecil and Ida Green Honors Chair to bring trauma and expressive arts research and work through the U.S. Department of Education into classrooms. Isn't that amazing? A grant of
very surprising too.
$3.7 million to invest into expressive art therapies to be applied into schools yeah.
Yeah, we'll talk about that too if people have questions.
And please, we had the privilege to meet in person in Barcelona in 2019, just before the pandemic. And we're hoping to have Cathy and Elizabeth come to Spain in November. Cathy has assisted more than 500 agencies, organizations, and institutions to develop trauma-informed, expressive, and responsive programming, including the World Health Organization's United Nations, the Department of Defense, Kennedy Center, Harvard University, MIT, Johns Hopkins, and various universities around the US and the world. She's been interviewed, of course, in the mainstream media like Time Magazine, CNN, Cosmopolitan, Marie Claire. She's been invited as a guest of honor in Australia Childhood Foundation, Trauma Research Foundation, and many other places. Isn't it a privilege? She has written how many books, Cathy? 7?
I think it's 21.
21 and in 20.
Yeah, I don't count.
21 and in 20 languages, right?
Yes.
Yes. And we will soon have one of her books published in Spanish, luckily. So, and we also have the honor to have Elizabeth Warson with us, PhD, and many other credentials, which I wish I know what they are. EMDR, art therapy, right, Elizabeth? She's the founder of American Indian Art Therapy. I would love to hear more about that. Based on her faculty research associated with the graduate art therapy programs in George Washington University and Eastern Virginia Medical School, Elizabeth currently resides in Northern Colorado, where she maintains an equine-assisted EMDR and arts-informed private practice. Wow, working with horses, that's amazing. And we'd love to hear more about that too. So I'm very curious, Elizabeth, to know more about this. I'm looking forward to having you also with Cathy in Sitges in November. Yes, so Elizabeth also is a faculty member of the Trauma-Informed Practices and Expressive Art Therapy Institute. She teaches in person and online poly-informed equine-assisted and bilateral stimulation sensory motor informed expressive arts therapy. I was telling that we have the privilege to have the Spanish Association for Art Therapy supporting this event, and the Spanish Dance and Movement Therapy Association as well. So it's very nice to, and the official Colegio Oficial de la Psicología de Cataluña is also supporting your event. So this is really a coming together. Yeah. So be most welcome, Cathy and Elizabeth. And I'm gonna unpin myself. Yes. So Cathy, feel free to commence and Elizabeth together a conversation around what has happened with expressive art therapies and trauma work and neurobiology and attachment. How has this evolved for you in your global work?
Oh, that's a big question.
Big, broad question, but let's start by small pieces of where are you at now, and how are you bringing out this to the different population?
Well, I guess I'll start with, because both Elizabeth and I are practically on the internet with each other every week with a sort of a global community of people interested in expressive arts therapy. However, our community is quite diverse, right, Elizabeth? It's more than just arts therapists. It's counselors and psychologists. Last year, I believe it was last year, we had psychiatrists attending, and actually attended, we'll get to the topic of some of what Elizabeth does in equine therapy, but they went through all of that programming. So I think that's the first thing I want to say is a lot of people outside of the arts therapies per se are understanding the value of all of this. And I'm really happy about that, because I think both Elizabeth and I agree that many people that are practicing with trauma survivors or working with attachment or working with some other related challenges in people need these kinds of sensory-based expressive approaches that are body-based in order to really address the issues that many different populations bring to treatment. So I don't know, Elizabeth, if you want to add to that, but I was just thinking how often we're on here together having a conversation together. We're kind of famous for that now. People sometimes take our classes because they want to see us interact. So, because we have really great discussions about this, and they've evolved over the years. So I'm putting you on the spot.
I know, I'm ready. Yeah, we have wonderful collaborations. So working with nature-based expressive arts therapy that emerged from some of the work that we did in New Mexico, specifically Abiquiu. And so that beautiful place has really inspired us to do projects like that. We've also done a lot of work with bilateral just forms of art making, which if you are also an EMDR person, you know the importance of the bilateral stimulation. And so we offer a lot of alternatives to that, and movement and art making. I do that also with animal assisted therapy as well. So yes, our work just, continues, and we collaborate. So a lot of beautiful things have come out of this.
Yeah, I think we have the benefit of being able to, through this online teaching over the last few years, to develop some new ideas really quickly. And I just want to highlight one of them, which keeps coming up now in the trauma-based research. Some of you are familiar with Ruth Lanius, who's in Canada and does a lot of research in the area of trauma, but there's a big focus right now in trauma-based research around sensory processing and sensory integration. And all of this, I think Elizabeth and I, over the years, over decades, intuitively knew about, but now the actual research is coming out to support why we would use expressive work with people, because the research scientists like Dr. Lanius and others are saying that that needs to be the foundation before we even start to ask people questions about what they experience, what their memories are. We need to strengthen that somatosensory, the somatic, the body-based, and the sensory parts of that person, help them express through those means, those which we call bottom up, working from the body up to the brain. And she's coming out with some tremendous data that really supports these expressive arts approaches, these sensory-based approaches, and body-based approaches. And I just want to highlight one of the things lately in the courses, even online. Elizabeth's been studying a lot about Tai Chi and some different movement practices, and how even though these things are centuries old, now we're starting to understand, like, why is that related to EMDR? Why is that related to sensory processing? Why is it related to health in general? Where would you like me to go next, Enrique?
Yes, I'm really wanting, I would like to address how people in the mental health profession who are mostly trained to work from the top down can benefit from doing it art even for themselves. Even those people who have never done any art at all, who are ashamed of whatever scribbles go out of their hands. And when you ask them to do some movement in the practice, they get so ashamed. And how we can encourage this to shift for mental health practice, who is more cognitive based, and that need to really begin to embrace and open up to what you're bringing, because you're bringing music, you're bringing imagination, you're bringing artwork, you're bringing horses, you're bringing a lot of resources for us to explore the variety. You're bringing ancient cultural practices. How this variety of practices will really enrich not only the scope of healing, but people may have, the people I've spoken with are puzzled on how are they going to do this.
Well, the first thing is, it's not that difficult.
It's not that difficult, right?
These are very simple things, but I also just want to back up into two words that I think, well, one word in particular that gets people resistant. They think they have to be creative. And I hardly use that word. I use the word expressive, because creativity is something that we have cultural values around. We seem to have rules around what is creative and what isn't, but everyone can be expressive. And that's the thing I really believe is missing from talk-based psychotherapy, is we can be expressive through words with the therapist, but there are all these other forms of expression that are nonverbal, that when it comes to trauma, people do not have the language available to express. So that's one piece there. The second piece is, and I always talk about this in almost every course I teach, the idea which we call embodied cognition, which is the body in motion, learns more, feels more, expresses more. This is really the irony of talk therapy with trauma survivors. If we're just sitting in seats across from each other, we don't have that movement of the entire body. We don't have those expressive, nonverbal communications that are really necessary to repair what's going on in the body and the mind, and what's necessary to this idea of embodied cognition. So to me, this is the missing piece in psychotherapy, is to add in small parts of movement. It doesn't have to be your whole session, but introducing ways to use sound or use image making in very simple ways. You know, all these things, I think, are really the foundations to getting the talk, getting to the verbalization.
Exactly.
Yeah.
And what would be the role of learning neurobiology, like all this anatomy of the middle brain and the limbic system and the cortex? How can this help us in expressive art therapies.
Well, I'm going to call on Elizabeth here for a second, because we have this great consultant in her father, who is a medical doctor who we talk to, and she talks to a lot and interviews him about all these issues to make sure that we're on the right pathway when we think about how do we connect expressive work. And of course, Elizabeth also includes equine therapy, horses in the mix. How does that all make sense with all the things that we're learning about the brain? I don't know, am I correct? I mean, I think your father has really helped us a lot in the neurobiology department.
Oh yeah, definitely.
Yeah.
Yeah, so, and in the work that we do, there's definitely a bilateral emphasis, because when we do bilateral work, whether it's movement or rhythmic work or having a certain cadence with that, there's a lot of wonderful connectivity that goes on with the brain. So and we're crossing the midline and just all those wonderful things that we're enhancing. And so I bring in a lot of that collaborative work I did with my father, who's actually a neurosurgeon. So he has that structural background and certainly knows neuroanatomy well. So we've practiced all different kinds of movements, and we bring that in and the implications for that, how that helps with physical and emotional regulation, what that does to the brain. And so really have just had wonderful discussion around that, because there's so much out there in terms of the internet and different programs, et cetera, but there's not a lot of research on what does this bilateral movement mean? What are the implications when we bring it to bilateral forms of art making, to bilateral painting, drawing, et cetera?
So in this bilateral, you mean ways that we connect our right brain and our left brain and our image, how we perceive things through images, and how we bring narratives to those images, and how these get together, right?
Yeah, yes, exactly. And it's definitely a bottom-up process. So the words certainly come later. In fact, my father always says, when you're so immersed in some of this bottom-up art making, it's difficult to go into some of the regions of the brain where you can then speak about it or even write about it, that there's almost like a delay that happens because we're so immersed in that process. And he feels like, and he's one of the few doctors I know, medical doctors, who says it's so important to do things from that bottom-up approach versus being prefrontal lobe cognition around some of, discussions about, trauma or things that are activating, et cetera, because, it's not really helping with that connectivity, so much, because you're not being like more in a whole brain approach. It's just very, very, very exclusive to this region here.
There's another piece to this too that's really specific to the approach of expressive arts therapy, right? I keep saying this arts, but it could be just multi-sensory. And when we're doing these processes in teaching or working with people, working with patients, expressive arts therapy means you're going to multiple senses. And there's a reason for that. To start with movement and sound, something that's very basic to the body, and to move up through maybe enactment, but into image making. Image making is a higher process, even if it's just scribbling or making bilateral drawings on paper. Images, the image making process leads to language. We know that. So a lot of times I get questions from Bessel van der Kolk, Ed Tronick, Bruce Perry. I'm trying to think who else has asked me, and they're all neuroscientists. And they say, why don't you just stay with the movement and the sound? And I say, no, I mean, that's helpful. It's a helpful place for some people to engage. But to add all those sensory experiences, if we can get to that place where they can just put something on paper, whether it's colors, shapes, lines, or maybe they make an image, that image, we know for over the last several decades, that kind of image making starts to re-stimulate that language part of the brain. This is a really powerful thing to go through all those different, very simple experiences, because that's a lot of what psychotherapists are trying to achieve with a patient who has had trauma that can't express it in language, is to sensitively, slowly get to that place where they can start to express themselves with words again. So that's, I get excited about that, because I think, again, you know, many clinicians of all different backgrounds need to have these methods within their, you know, talk therapy. They need to introduce some of this in order to make the talk therapy work more effectively. And this, I think, is, again, back to the neuroscientists like Dr. Lanius, looking at how sensory processing in different ways leads to language, leads to the cognitive part coming back online.
Yes,
That makes sense, because I think that's the thing. A lot of people looking at this from the outside and think, well, there are a lot of different art activities that you do. You know, it's not that simple. We're really thinking through a lot of ways based on the research that we can either help people calm down or help them enliven their body, right? Because sometimes people are feeling dissociated in an uncomfortable way, numb, withdrawn. And these things also can enliven as well as regulate the body.
yes, yes.
Yeah.
And we're coming to a time where it's vastly recognized that it's so important to focus on the body language, but also knowing all these pieces that you're bringing with your work. It's not just drawing or movement for movement, or you know, or doing therapy for doing therapy. It's like a coming together of many things to bring about what comes about, as you've seen in your practice.
Yeah, I was just thinking about Elizabeth. You always describe the example in equine therapy with horses about bilateral brushing. I mean, even thinking about, okay, you're interacting with this horse and doing that with both hands, brushing the horse and using that in different ways, right? I mean,
Definitely. And getting the rhythm down and watching the horse behavior and knowing when to slow down, because the horse will reflect that. And yeah, it's pretty powerful. It's a great way to learn the cadence and the rhythm.
yeah.
And where does the attachment piece come in?
That's a big question. But I think the word rhythm is really, to me, where it starts. It's that movement or sound. There are three basic things that come to all of us before we're even born. And one is at 8 weeks before we're born, you know, we're conceived in 8 weeks in our mother's womb. Touch becomes a very important thing. We start to have that sensation. Then there's movement and rhythm. And those form these three things that relate to our ability to regulate. And if we, before we're born and in the first few years of life, we get those good experiences, we have a pretty good life ahead of us with regulation. But many people, children in particular that have adverse experiences, they're not regulated in that way. But we have, again, you can't talk to people about those three things: touch, movement, and rhythm. They have to experience it somehow, again, in their body, to start to understand how to regulate and co-regulate, maybe with the therapist, and then learn to co-regulate with the parent or the caretaker. So I think those three things are the foundations. There are other things, but those are the foundations of that attachment. They're there in development. We just have to look at early development for that.
Yes. And when you work with these agencies that support children who are traumatized, how do you teach their stuff? What do you teach them? You teach them all these things, right?
Yeah. Because childcare workers, for example, can really benefit from knowing a lot of these approaches. Right now, in working with the Department of Education grant with the teachers in the classroom see the most traumatized children of any people in our country, in the US. They have whole classrooms of children who are now very anxious, depressed. We have the unfortunate situation in the US where some of them worry about school shootings and violence. There's bullying in person or on social media. So the teachers in the United States have a tremendous challenge. So what we're learning in the grant, in the research, teaching a lot of these methods is helping the teachers regulate the class through themselves. So there's that co-regulation with movement and sound and, all the things that we've mentioned here. Also, the teachers are getting regulated. This is the other part we're learning. We didn't think about this because we were assigned the students. How do you help the students, feel better and recover or get out of their anxiety or be enlivened more and not be so depressed? The teachers now are telling us, I was going to quit my job as a teacher, but now I found that doing these things with the students a few times a week, I'm feeling more connected to them. I feel like I'm communicating more effectively with them. That's really powerful. So we're not talking about people who are trained as mental health professionals, but they have to face mental health issues in their classroom and in themselves, their own self-care. So a lot of the teachers now have adopted these practices in their own lives, and they continue them because you can just do it for a short amount of time and get some relief or feel reconnected to your body in a good way.
Yes.
Yeah.
People are asking where yeah. I think this is what we will be covering in the training in Sitges in Barcelona in
Exactly.
November, December.
Yeah, because I teach some of these now, the things we now know that have evidence that we're using in the classroom, that the teachers have given us feedback and the students have given us feedback, because I ask for this all the time from patients even. Give me feedback about what's effective for you. And now we're getting that data from both the students and the teachers about what processes are working for them, but also they're making adaptations for us. Even the children. I mean, they know how to make it feel better. Like, let's do it this way. So all that, will be in the training and more. As we go along through the year, we'll even have more data by November about the practices. I know Elizabeth sees you see a lot of teenagers in particular, right? And young adults. Yeah, you see children too. Yeah.
Children, adolescents, adults, and elders. Yes.
Yeah, we talk about this a lot. I mean, I think you have the same impression about the very increased level of anxiety and depression. Yeah.
Yes.
Pandemic. Yeah.
Somebody's asking, what's the role of mindfulness in this integration? So it's a big one, a big role.
Well, both of us, of course, have taken all the classes and know all about the whole field of mindfulness and where that fits in. But I think when you're asking people to engage in the expressive work, for most of them, it's the first time. And it's a novel experience. And I think that's what makes it helpful, because all of a sudden they're doing something that's not the usual behavior that they're going through all the time. They're now engaged in something that's totally different. And that is a mindfulness practice in and of itself, to refocus in a different way on how one communicates and the different possibilities for that. But I'm sure that the person's asking probably the details of how do we bring the mindfulness practice in. I think we go off the normal way that you learn mindfulness into some different kinds of, I'm very, both of us are very conscious of breath, right? And it's based on experiences, I think. Well, Elizabeth, you talk about the breathing patterns that you introduce, with the people you see.
Yeah, we do a lot of bilateral movement, art making, and then we even bring it into a visual journaling practice. That's all mindfulness. Just our present breath, and then going into something that's more focused. So it's not, here are these breathing exercises that will be helpful. It's like we literally take them through, engage them in those practices.
Yeah. So one of the popular things, and it's become part of the curriculum now after 2 years of this 5-year education grant, is using the out breath. So when we breathe in, we give ourselves energy. When we breathe out and exhale, we calm the body. So just teaching that simple practice to teachers and then teaching it to students and then having them do movements with it, make sounds about that exhale, that out breath, which, again, this is all based in the mindfulness information that we know. Then having them draw what that looks like. What does that breath look like? This has been something now that in most of the classrooms where I live, they're having students do this regularly, just for 15 minutes, maybe every other day. And just being conscious of breathing, exhaling, and calming the body down through that exhale. So I think that's how you have to introduce the mindfulness piece to the average person. Doesn't want to sit and meditate for long periods of time, but they need practices to either engage their body and enliven it or calm themselves down in some way. Oops, you're on mute, Enrique. Oops.
I sneezed, but I muted.
Sneeze.
So I muted myself. Yeah, thank you. So my hope is that people in Spain and Latin America can take these valuable practices and these valuable teachings to their workplace, to their clinical practices. And I'm wondering, already many art therapists are here from Spain. Please type, if you're an art therapist, just type, yes, I'm an art therapist in Spain. So I know you're there. And are you taking this to the primary care? Are you taking this to psychological emergencies? I know, Cathy, you've been involved with Elizabeth, maybe also with the Turkish earthquake emergency. Was that right? Can you share this experience?
Yeah, and exactly the practice that I just talked about was part of the training with the Turkish psychologists over the last month in some online webinars. And I'm already getting feedback about that, about how powerful that is. And some of the things that we did, and Elizabeth does these too, with different positions of the body, just, self-holding and self-touch, and finding out, where people can find from simple movements with their own body some kind of comfort, because the earthquake situation is going to be a long-term recovery. How do we help people feel better in the moment, at least for little moments, of escape, to feel good about what we're sensing in our body is a big part of that relief effort.
Yes, so this works at a very micro level, but it adds on to a complete wellness.
Yeah, I think the thing about disaster relief, because I've really been involved in that over 3 decades with natural disasters, man-made disasters, unfortunate to say, school shootings in the United States, and working with survivors and also responders, like police and firefighters, all these support personnel. We wanted to have them talk too much 30 years ago. I asked them so many questions. Now we know from back to the neurobiology that the brain is not going to cooperate with this. The brain language area starts to silence or it becomes overwhelming. It's not good for the body to start to talk, but to do things that either calm the body or enliven the body is what is needed. And we know so much more now. It's so great to see that these simple approaches are things that we can bring to people where there is disaster. And the Turkish disaster in Syria is monumental. So, people cannot even articulate yet what their grief and loss is, but their body is feeling a lot of things that they can address through some simple techniques.
Yeah, you had 600 online Turkish.
Yeah. Mm-hmm. Yeah, every week. Everyone came. Yeah.
Were they able to practice and tell you?
Oh, yeah. Yeah.
What was going on for them?
Yeah. A lot of good feedback. And a lot of them, psychologists who are very familiar with a lot of different approaches, EMDR, the eye movement desensitization and reprocessing, somatic experiencing, sensory motor psychotherapy, familiar with polyvagal theory. So all of this started to make a lot of sense with the approach if they were working from those models and they saw like, oh yeah, this fits in with how I do somatic work. This fits in with how I understand polyvagal theory, the bilateral, they understand, related to the bilateral stimulation and EMDR. So this all comes together. Yeah.
Yes. And how as an expressive art therapist, how do you present yourself with your clients, with your patients, or what's your stance? How do you work on yourself? You are one of the team. How do you address them when they're in such a distress as you bring them through to do this work?
Elizabeth, I'm going to shift to you for a second. So we do this all the time. This is so I get a drink of tea.
I was attempting to write a response in Spanish, so because I grew up speaking Spanish, but I'm not fluent. But so I was attempting to, because someone asked pueden escribir en español de modelos, and I was wondering like qué tipo de modelos. So that's what I was wondering.
Yeah, they want like teoría polivagal, somatic experiencing, EMDR,
Okay.
psicoterapia sensoriomotriz.
Okay. Because just in expressive arts therapy, there's so many different, approaches, so yeah.
So it's more open and broad to being receptive and warm and close to whoever comes for asking for help, right? Yeah.
So, what I always say too, partly I've worked a lot with the military in the United States, so they get a referral to me, and they kind of are interested, like, who is this person who does something that's not just about talk. They're kind of happy to come because they say, I heard that I don't have to talk in this session if I don't want to. And I always say, yeah. And I think they're going to talk. They always do. But I say, yeah. I say, there's a lot of ways we can do this. And let me give you some examples today. I usually like to start with movement, and we might do that for first 5 minutes every time you come. Just to start, we'll find a movement or something that, we'll be comfortable with, and then we can explore sound. I have percussion instruments, musical instruments. We can, pursue drawing. There's a lot of different avenues, and we'll find out what's comfortable for you. It's going to take a little while. And yeah, that's how I introduce it. But they already kind of know when they come it's going to be different than just sitting and talking. But I also use EMDR. I use different methods that are integrated in that. And some of them are already familiar with that. They've had some EMDR sessions. So I say, well, I do this a little different because I put this expressive work in here. And so we might do it standing up and moving, or, we might do some bilateral work on paper, those kinds of things.
And when somebody is really collapsed, when a client or a patient is really collapsed, that they cannot really move, they're really paralyzed or frozen, how do you help them get enlivened?
No, you don't make them get there right away. You can sit there and we can move in the chairs. Yeah, because I have some patients who have traumatic brain injury, and for them, balance is really an issue. So they need to be grounded somehow in their chair. So it's not an immediate process. You start, I think every psychotherapist is familiar with our practitioner. You have to start where they are to feel comfortable with, what their capabilities are. I don't know, when they come to equine therapy, I was thinking how they already know they're going to be around horses, but how is it that they learn? Because you have easels and all these things where they can do art, they can move around with you in the proximity of the horses, but do you ever have to actually explain who you are and what your background is? Yeah. Sometimes it isn't necessary.
I was wondering, there's a question by Anna Duran. She said she's done the foundation course in your institute in 2021. Would this course in Barcelona be any different from that?
Oh my goodness, yeah. Each time we even teach a course, every year it changes, but it'd be quite different, because now I think we know so much more about embodiment, which I talk about restorative embodiment, how we restore the body, because a lot of what talk doesn't do is restoration. It can relieve the symptoms, but how do we restore people's feelings of joy and enlivenment and compassion and confidence, mastery, all of these things. So, oh yeah, it's quite different.
Yes, perfect. So we're nearly at the end of, we have 10 more minutes. I don't know if you want to take any questions, or is there something I'm not addressing yet? Expanding the circle of capacity. Yes, that's a good subject. That's
Mitch. Hi, Mitch. Okay, well, yeah, Elizabeth's already smiling because I often take other people's principles that I think work well in talk therapy. And one of them that works very well in talk therapy, and we've all used it, and it came around about 2009, is Dan Siegel's window of tolerance. A lot of people are familiar with that idea, that people that are traumatized can be very hyperactivated, so they're anxious and worried and fearful, or they can become numb, withdrawn, dissociated, and slow down, lethargic, no energy. And what our goal is in that model is to expand their tolerance for these states, and have more time that we're feeling calm, relaxed. I always say relaxed alertness. But I never liked that word tolerance when it came to expressive work, because expressive work does something in addition. And I started to think, what is that word I'm looking for? In the English language, it's capacity. It's telling people that we're not going to only try to help you reduce those reactions that make you so uncomfortable and feel suffering and pain. We're also going to increase your capacity for things that feel good in our body and our mind and our spirit. And I thought, like, yeah, this is exactly what expressive arts therapy is to me when I kind of put it aside, right alongside of psychotherapy, which, you know, again, talk therapy does a lot of very effective things for trauma. But what do we do that's value added? What do we do that's different? And this is what I think is very special about the expressive work, that people naturally start to expand this capacity. In fact, instead of a window, I make it a circle, and it's going to get smaller and bigger. We get hit with things in life that create stress. So sometimes our circle gets smaller. But what we're doing in the sessions is trying to increase the capacity for regulation, self-regulation, co-regulation, resilience, and then all those things that should come about when we're in recovery: joy, pleasure, playfulness, you know, back into life in a joyful, regulated way. So yeah, I'm glad Mitch brought that up, because that's, yeah, that's my big platform, is we want to build capacity in people.
Yeah, Barbara Fredrickson, with her positive research, also adds something to that, right?
Yeah.
Expanding these positive experiences and feelings, we receive a very important healing.
Yeah.
And
And I think it's Rick Hansen, I don't know where the research came from, but that as humans, we really do have a tendency to be negative. And that is for survival, because way back thousands of years ago, if a tiger was chasing you, you needed to be negative and get anxious to get away from the tiger. You know? So we still have that in our brain. And they say for every negative experience or negative thought that we have or sensation, we need 5 positive ones to change that. Is that going to happen if we're just sitting in a chair talking to each other? Probably not. You know, and I think, again, you know, in doing the work and helping people find some new life in their bodies and playfulness and expressiveness, I think, again, what Elizabeth does with bringing a sentient being, which is the horse, into that mixture, people start to get this different sense, you know, that, but we need to weigh it a lot into that positive area in order to start to address the one negative sensation, the 5 positive for that. So I think, yeah, that was part of her work, but part of his work too. Somebody did the research on that we really need an overload of positive experiences.
And your quote was, express it to address it, right?
Yes. Well, that's another thing. Dan Siegel's, poor Dan, he says a wonderful thing: name it to tame it. And I think, like, yeah, that makes sense when if we're only in the talk mode. But if we're going to get beyond just verbal language, there's all the other forms of communication that humans have used for thousands of years that are expressive, and that there may be not only trauma survivors, but people with you know, who are autistic, people who have a issue with language, cultural issues. There can be a lot of different ways other cultures need to maybe express. So there's a lot of, to me, a reason to just be expressive non-verbally.
Yes, I was talking this morning to some Greek therapists, and they were saying that clients don't go to therapy in Greece, but they join theater groups to do their psychotherapy work.
Yeah.
Makes sense for the Greeks. Yeah. So thank you very, very much for coming for this call, and we will place this recording and send it to all the people who signed in. You'll receive an email with the recording in English and in Spanish with a translation for you to watch as many times as you want. And we will hold this workshop in November 30th. It's a level 1 certification program with Cathy, and we hope to have her in this area of the world more often, and to really shower us with all her, incredible work and lifetime research. So really, thank you, Elizabeth, Cathy. It's such a pleasure to have you with us. And thank you, everybody, for coming and taking the time on a Friday.
Yeah, for some people, it's the middle of the night. I'm looking at some of the places that people signed in from. That's always impressive to me.